Behavioral challenges are behaviors that cause significant harm or disruption to oneself or others and may result in someone being excluded from activities. Milder examples include not listening to instructions, having tantrums or meltdowns. More severe examples include self-injury or hurting others. Tantrums are the most common type of behavioral challenges in young children. It may start when a child is around 1 year old and is learning to become more independent. At this stage, he or she may appear to be demanding, stubborn, and uncooperative. Tantrums are common in 2-year-olds and can be as short as a few seconds or last for an hour. The type of tantrums varies widely and can include crying, screaming and yelling, stamping of feet, rolling on the floor, holding their breath, head banging, flipping their body backwards, throwing things, etc. Regardless of the type of challenging behavior, it is important to realize that there is a purpose for every behavior. Your child is trying to communicate with you through that behavior. When your child exhibits a less desirable behavior, it could be that he or she is unable to cope with the stresses from the environment or demands from a task. As much as it might seem like it, your child is not trying to make things difficult for you. Some children may have difficulties in communication due to language, social, or cognitive challenges. They are likely to show more difficult behaviors when they struggle to communicate or express their feelings and needs effectively with the people around them. Common triggers of challenging behaviors include being told no, things not going the way your child expects, being unable to manage a task, feeling overwhelmed and tired, or sometimes the reason is not obvious to the adult at all. There are 4 main reasons why children display challenging behaviors. The first reason is when your child has something he or she wants. Commonly, a child may use his or her behavior to get attention, to get an object, or to do an activity. The second reason for a behavior is to escape something. The child may use challenging behaviors to try to get out of demands or responsibilities placed on them. The third reason for a behavior is that the child is feeling very emotional and acts out. This could be due to any emotion that the child feels intensely, such as anxiety, frustration, or stress. These emotions are usually triggered by an external event or person. The last reason for a challenging behavior is when a child is feeling physically unwell. He or she could be ill or just hungry and tired. This decreases their ability to regulate themselves to stay calm and can lead to challenging behaviors. Parents should not feel reluctant to seek help in coping with challenging behaviors. Doing so doesn't reflect badly on the child or on the parent. Consider seeking help from professionals when the challenging behaviors persist, even after you've tried multiple solutions, especially when these behaviors occur both at home and in school. Also consider seeking help when you are lost and conflicted when faced with your child's behaviors, especially when these behaviors are affecting your family's functioning, relationships, and quality of life. Know that positive approaches are sufficient in managing challenging behaviors. If you find yourself resorting to negative methods often, speak to a professional. They can give you alternatives. Children have different temperaments. Some children are calm and easygoing and rarely have challenging behaviors, while others have quick tempers and find it much harder to regulate themselves. Some children are just more difficult to manage than others, and this is usually due to multiple reasons. A professional familiar with managing behaviors in children can help you with a behavioral management plan. The aim of a behavioral management plan is to teach a child how to regulate themselves and to solve problems in acceptable ways. Like all other skills, children need caregivers to help them learn this.